So we'll say hello, good afternoon, or good morning, everyone. Thanks so much for joining our call today. This is the Community Action Transit Forum, which is all about the different ways that community action agencies are helping to connect people to the places that they need to go in their local communities. So I'm Mary Beth Schnaber-Remrev. I'm the Director of Organizational Capacity Building here at the National Community Action Partnership. And I'm really excited to see everyone here today. So a few quick notes right off the top, just so we're all on the same page. Number one, we are recording while we're here in the main room. So you will get a copy of this recording in just a few days after the session. You might notice that we are in meeting mode, and that is intentional. We want this to really be a participatory session. We have a great panel of presenters, and we also want to hear all of the expertise from all of you as well. And so you're going to have lots of opportunities to talk with one another, to share your expertise, and make comments and questions throughout our time together. To kick us off on that space, if you want to say hello in the chat, include your name, your organization, your favorite holiday food if you are so inclined, and thinking in that space like I am all of the time now for the next, 10 days or so. Um, I will also note, though, that because we're in meeting mode, which is wonderful, it also means you can mute and unmute yourself. I'll just ask that you please keep yourself muted when you are not speaking. And with that, I think I want to start us off by reciting the promise of community action. The promise reads that community action changes people's lives, embodies a spirit of hope, improves communities, and makes America a better place to live. We care about the entire community, and we are dedicated to helping people help themselves and each other. This great panel today is going to talk all about how they're fulfilling this promise of community action, really helping people to help themselves and even help each other through lots of avenues like volunteer transit, like employment-focused transit, like rural transit. So we're really excited for our time together today. So we do have a special guest with us as well today, Denise Harlow, our CEO with the National Community Action Partnership. She wanted to make a few remarks and say hello to everybody. So Denise, I will pass to you.
Thank you, Mary Beth. I appreciate just a minute or two here just to say welcome to our first transit forum. This is really exciting. The Community Action Partnership, has done all sorts of training and technical assistance over the years, as you know, and transit is such a critical element of what community action does in every corner of America. And you'll see that amongst our panelists here today from every corner of America. So thank you so much for joining us here today. And we're really excited, Bill Wagner's here as well, because we get to do this work in collaboration and partnership with the Coordinating Council on Access and Mobility and their Technical Assistance Center, affectionately known as CCAM. So, Bill, thank you so much for your partnership, your collaboration, and being able to lift up the great work of what Community Action does in transportation every day is really a great opportunity to help expand and grow it exponentially across this network. Community action agencies, as you all know, are required to do a needs assessment every 3 years. And for as long as I can remember, housing and transportation end up in the top categories for most community action agency community assessments. It is a critical factor for medical, for work, for childcare, for education, for daily life. And you're going to hear today some really wonderful examples of how community action is helping to meet needs across America. Um, Community action is unique in every community, and you're going to hear a variety of examples. We also, and while we have a great panel here today, I also know there are many folks, as you've introduced yourself here as well, are working in the transit space. And I talk to community action agencies every day who are doing some sort of transit and running very large transit systems across this country. So please ask questions, dialogue, share your experiences. You're going to have a chance to get into small groups and have some conversations. We really want to learn from this so we can do more of this to help meet the needs of the Community Action Network. So please stay connected to this group. Mary Beth is great on follow-up. You're going to get those slides and all those pieces right quick, and you're going to stay connected. keep reading our newsletter. We hope that you will begin 2026 really by leaning in on transportation and our partnership with CCAM and the Technical Assistance Center. We look forward to really working with the network, increasing the footprint of transit within community action, and helping families every day do what they need to do to get to medical, to get to childcare, to get to education, to get to work. And live their lives. So, thank you so much for being here, for dedicating part of your day, part of your week, which is a very busy week, I know, to this work. So, Mary Beth, thank you for your leadership on this project, and I'm going to turn it back over to you.
Thank you, Denise. Great to hear from you. Thanks for making time in your busy schedule to be with all of us. And Denise queued up that we have a fabulous panel today. And so what we'd like to do is just to introduce you to them very briefly. You're going to hear more from them in just a little bit. But why don't we just go down the line and introduce our panelists. So Panhandle friends, would you like to say hello?
Yes, hello and good morning. Well, actually, good afternoon. I'm Lylene Springer, and I'm the Transit Director for Panhandle Community Services here in the Panhandle of Texas.
My name is Robert George. I'm Eileen's assistant here at Panhandle Transit.
Friends in Maui.
Aloha, good morning from Maui. I'm Debbie Kabibi. I'm the Chief Executive Officer for Maui Economic Opportunity. I'm going to pass it over to Patty. And then Patty, you can introduce Maggie.
Aloha, I'm Patty Copperfield. I'm the Transportation Director for MEO. And Maggie can do her intro.
Good morning, I'm Maggie Batungan, and I'm the Chief Administrative Officer here at MEO.
Great to hear from our Maui friends. Good morning. And then our friends in West Central, New Growth Transit. Excuse me.
Hello, I'm on the call today from West Central Missouri. My name is Kelly Oss, and I am the Regional Chief Mobility Officer for a volunteer transportation program, New Growth Transit.
And then Bill, would you like to say hello from CCAM-TAC?
Sure. Thanks, Mary Beth. Good afternoon. I'm Bill Wagner. I am from Washington, D.C., our offices of the Community Transportation Association of America, and I run a technical assistance center that is funded through the Federal Transit Administration called CCAM-TAC.
That's great. And so thank you, Bill. Thanks so much for being with us. Friends, if you're going, wow, that's an awesome panel. What are we going to do together? This is basically the outline of how our time together is going to go. I'll flag for you that this session is meant to go for an hour and a half. We have scheduled the full hour and a half full of content. We've done the welcome, so check, that's done. Then each one of our friends that you just heard from are going to tell you a little bit about how they are approaching transit in their local community. And so you can kind of see what they will talk about there. Everyone's going to have about 12 minutes to chat. As folks are presenting, if you have questions, if you want to put them into the chat for us, that would be wonderful, because we will have some dedicated Q&A time for you to interface with our panelists and with each other too. Even if your question isn't for the panelists, if you have a question for each other, please go ahead and put that in the chat. Then we're going to pass it to Bill to tell us a little bit about some of the tools and resources that are available through CCAM-TAC. They are free, they are high quality, they are wonderful and helpful for you if you are running transit or thinking about running transit in your community. Then we're going to have some time for some topical breakout rooms. You're going to get to choose which conversation you go to. You'll have some time then to connect with each other, and then we're going to close up with some final reflections. So with that, why don't we jump into the part that you all are probably most excited for, which is hearing from your peers from around the country. And so I'm going to pass to our friends at Panhandle Community Services to talk to us about transit to work.
Okay, up here in, I don't know how many of you are really familiar with Texas, but here at Panhandle Community Services, we actually run the top 26 counties. And that's just a little under 26,000 square miles that we try to operate in. In fact, in the state of Texas, we are the largest rural transit agency. And there's a lot of barriers up here, mainly because of all the miles that we have to run. And the needs assessment that Denise was talking about, transportation always comes up as a need. And although we try to meet all the needs up here, we struggle with meeting all the needs. But about 22 years ago, I've been here 23 years, but about 22 years ago, we decided to apply for what is called then the JARC grant. And I don't know if any of you know what that means, but it is the Job Access Reverse Commute Grant. And so we teamed up with some partners because here in the Panhandle, you know, it's cow country. We have probably the 3 largest packing houses in the world. We have Cargill, we have Tyson, and we have JBS. And so we started off with Cargill, and we had lots of conversations with them to see if they really wanted to partner with us as we were writing this grant. And they were all for it, and they have been a great partner ever since. So we wrote this grant with TxDOT, and we were awarded $750,000. And what we did with that, we purchased 4 buses that could hold anywhere from 29 passengers to 40 passengers. And we started that route with Cargill. We started just doing one first shift. They run 2 shifts, but we started with first shift to see if it would actually fill a bus. And it not only filled a bus, then we started doing a second shift. And then when that money ran out, then Cargill still wanted to be partners, because anyone who's worked in a packing house knows that's probably not a very fun job. So employee turnover was very high. And their main goal was trying to get employees to work. And so they actually started a route from Amarillo to Cargill also. So at that time, we were actually we ran all 4 buses, and we were doing both their first and second shift. And since then, it has just multiplied, and we went to, since we are the Rural 5311 agency here in the Panhandle, I cannot participate in fixed routes. So we have to be there at kind of like a deviation of a fixed route, because if I have to, I have to. But all of our buses are equipped with lifts, so we're still public transportation. Then along came Tyson. Tyson's been a struggle, and if you've been reading the papers, Tyson is really struggling right now. And we struggled with Tyson too. And at the time, that is when Tyson was getting all the refugees in from other countries, and they didn't have any vehicles. So the Tyson transit to work has really been a struggle for us. And then I also run the shuttles for our university here in Canyon. And because of that, that struck up another partnership, because they wanted to bus in their custodians to come in the evening. And so we do that transit to work also. So our program has actually grown quite a bit. If you want to go to the next slide. That's how many trips we're up to for a year. So my physical year is from September 1st to August 31st. So from 2024 to 2025, we actually did 75,127 trips. And that's a lot of trips. It is nothing for us to run here in the Panhandle 7,500 miles a day. So this is and those are our buses. Those are our big buses, and we're all lined up because we have to have all those buses there at Cargill at the same time to do their shift work. Next slide. And those are even our clients are happy campers. They all wanted to pose for those pictures. Next slide. The struggles that we have, the barriers that we have, are actually finding CDL drivers up here. Because of all those vehicles, we have to have the CDL drivers. And besides these buses right here, you don't have to have CDL drivers for everything else that we do. But Bob, you have anything to say?
No, I went out and took pictures of all these passengers and the buses on the sites, and they were all just so happy to be a part of this show that we were putting on today, because they really depend on us, and a lot of them said that they didn't know what they would do if we weren't there to get them to work and get them back home after their shift.
So it's just been a good partnership all the way around. And when I map out how much the cost, I don't actually make money off these Cargill routes, these transit to work. I just need to make enough money to run these routes, because you don't make money in public transportation. But we do transport a lot of people back and forth to work. Does anyone have any questions? is that about 12 minutes? Maybe. I'm not going to sing, so.
Lylene, I think this is awesome to hear. I'll invite folks to either raise their hand or put questions in the chat if you have specific
Okay.
questions. But I have a question for you. So
Okay.
you mentioned, Cargill, you mentioned Tyson. So are they actually funding the trips for their employees? How does that funding work?
Well, Cargill, since what they do, and I think this is a really neat thing that they do for their employees, they give us rosters, so we know who we're picking up, but they pay for half of their employees' transportation. So the employee will pay half and then Cargill will pay the other half. Tyson, right now, they pay for the whole transportation. I think they're wanting to go to something like Cargill too. And then the other transit to work programs, they pay off of an invoice. That's all. But Cargill does partner with their employees. And they have a lot less turnover at Cargill than they do at these other packing plants. So
That's a great piece of information. How did you go about forming your partnership with these employers?
well, with Cargill, we just met with them and, it took 2 or 3 meetings for them to get on board. But when they heard after we received this JART grant and that we were going to pay to see if it was even going to work, because when you start up something new like this and it's big, you don't know if it's going to work. But when they saw that their employees were happy, we got them to work and their employees, actually the ridership did nothing but pick up. And we had to, because now I started out with 4 buses. I just counted, I now have 14 of those big buses that we have to run. So it just expanded. Transit to Work's one of the largest things we do for up here in the Panhandle. And we take a lot of people to work, don't get me wrong, but they can go on a little bus. But these are taking point A, picking up, and then taken to point B. So if you can see, we fill the buses.
That's incredible. From 4 to 14. That's incredible.
Yeah.
I think we might have answered this, but just to be clear, your current transportation work is being funded primarily then by those employers. And did I hear some 5311 funding as well?
Well, actually, there's some, yes, ma'am, there's always 5311 funding attached to everything because salaries have to come. Even though I can allocate it out, there's still 5311 funding, yes. And then, right, and then I actually have a transit to work fund too, that it's allocated out of. And since it's grown, it takes money to run. But yeah, 5311 funds are used.
Okay, so leveraging a little bit of investment from the federal
Right.
dollars and then really multiplying that, right, by
Right.
working with these private employers. That's wonderful.
Right.
Any other questions from folks on the call? That was the only question I saw in the chat.
I was typing mine out, but I did have a quick question.
Okay.
Yeah, this is Emma Woods. I'm coming from Illinois. So this is something that actually our transit system has a small kind of similar service happening, but we have really struggled to maintain relationships with our employers. Many times, whenever we're having these conversations, they are very gung ho and very interested in offering this type of transit. But once we start having conversations of getting funding from these employers, they often kind of stop answering our emails. And don't want to have those kind of conversations. I was just curious to see if you have any recommendations or experience with that and how to, maybe handle those situations better from your experiences.
Well, I think what probably helped us out the most is when we first started and we were funding I was doing the all of the funding, but what they really noticed is that these employees were getting to work. And so the drop-off rate of their employment, the turnover, I guess, it dropped considerably. And that right there is a big asset because we all know, the turnaround of employees, it's kind of a really big deal. And Cargill, they've never even deviated. In fact, they're actually wanting us to probably put another 2 buses very soon on the road. So I would just, that's a very strong talking point, is just getting their employees the employees to work. Because a lot of them do not have cars. They're even walking to the sites to be picked up.
Wow.
So,
Bill, I see you came off mute. Do you have advice or thoughts here?
Yeah, I had a couple questions. You mentioned that some of the employers are paying for the whole cost, if I heard right, for the employees to ride, and then some
yes.
are sharing the costs.
If they are sharing the cost, they're not sharing that information with me.
Okay. So
Cargill, I know they're sharing. I know they are because they do share that.
I know that a transit benefit is eligible for pre-tax withholding, and a lot of times it's a win-win situation where they can withhold, up to a certain percentage. And it's been a while since I've been involved in this, but and then they would pay you directly for their share and the employer share in a shared cost, and then the employer would benefit from their employee tax withholding as well as the employees benefiting from, reducing their income that they have to pay tax on by covering this transit benefit. So I was just curious if that's what was going on. It sounds like it.
Right. And Cargill, I do not have that packing house. I do not have a contract with them, and I'm okay with that because then, everything that they do is their business and it doesn't, roll over into mine. Tyson, I do have an MOU with them, and but they still don't share that. I mean, I don't know how they're doing it with employees, but I do know Cargill does.
And my last question, in following up, how willing are the employers to share data regarding, a reduction in the number of vacancies since they've had this arrangement with you, or reduced tardiness, with people getting to work on time, or reduced call-ins because their car broke down or anything? Do they share any of that with you? Do they have any way of measuring that?
Cargill does. They've just been great. And, like an example of this is when a couple years ago we had such a horrific ice storm up here and I could not put buses on the road. So this is a good example. It really did hurt those few days that we couldn't run because these individuals could not make it to work. I'm really sure that if I was to ask, they would provide me all the data that, that I needed. But our rosters with Cargill hardly ever change, and we always have a full bus. So when the pandemic hit, we had to, everybody had to shut down. And so that really hurt. They were really excited when we started those buses up again. So.
And my last question, I'm assuming that these contracts you have with the employers is what you use for your matching funds to leverage FTA funding, your local
I
match?
don't have a contract, but yes, now that is unrestricted money right there because it is from a different funding source. It's, from a non-federal source. So yes, it does. It does work as match.
So that's all great information, friends. If you have more questions for Panhandle, we're going to have a little more time for Q&A here in just a minute, but I think I'm going to move us ahead. Thank you so much, Eileen and our friends at Panhandle, and we'll hear more from you in just a little bit.
Okay.
With that, how about if we pass to Debbie in Maui?
Yeah, hi. Good morning, everybody. Debbie Kabibi, Maui Economic Opportunity, and we're known as MEO. Next slide. We are a community action agency designated, established on March 22nd, 1965. In 1965, Maui County had about 43,000 residents. In 2025, there are about 165,000. So we're still actually considered a rural area, although there are some urban areas that are designated now based on the last census. We're a unique county because we are made up of islands and we're separated by water. So there's Maui Island, Molokai, Lanai, and the island of Kaho'olawe, but that is not inhabited. Next slide, please. Today, MEO has 5 departments. We have 5 locations and then 9 Head Start centers. So we are on the islands of Molokai and Lanai and in the rural area of Hanamaui. We operate more than 30 programs, and we have about 30,000 individuals throughout our county every year. During the pandemic, and then during the recent wildfires, those numbers went up considerably to closer to about 55,000 individuals. Next slide, please. And transportation wasn't established until 1969, and it was a result of a community needs assessment. And it's identified that need. And we started with some funding through the Office of Economic Opportunity and a state grant and aid. Next slide, please. We got our first wheelchair accessible van by fundraising at the rodeo up in Makawao. And fundraised selling chili and rice and chow fun, and retrofitted one of our vans so that we could transport persons with disability. Next slide, please. So County of Maui actually is our primary funder today, and we looked for local funding to meet local needs, and the partnership from Maui County has been longstanding and continues to this day. Next slide, please. Our human service transportation is on all 3 islands, as I said, Maui, Molokai, and Lanai. Next slide, please. And in 1992, Maui County had their first public transit. So MEO was the only transit provider up until 1992, doing all these rural shuttles in various locations. And the county said, okay, well, we need to have some public transit. So MEO was the first public transit provider. We had 2 routes that were just in central Maui. Next slide, please. And then in 2002, the mayor at the time wanted to expand public transit, and they did a joint partnership with a tour company, Akina Tours, the County of Maui, and MEO. So Akina ran some of the routes, and MEO ran some of the routes. And this is a picture at the mall, and they use that as a transit hub. Next slide, please. The ridership was low, and it was due to the frequency and the geographic location that the public transit went. So they reduced the routes because it was costing the county a lot of money. Next slide, please. In 2005, the county finally did their first short range transit plan, and they evaluated services, and they developed a true public transit system. And this logo is what they came up with. Next slide, please. So again, the current public transit is a private partnership, public-private partnership between Robert Hawaii, who's one of the vendors that runs the large bus fixed routes. We run the paratransit, and Maui County funds those operations. Next slide, please. So MEO Human Services, which is where we started, we still run that program. That is a grant that comes through the County of Maui, and it serves all the areas that public transit doesn't cover. So we do senior services and nutrition programs. We do a Kalimo Maui and Easter Seals and Arc of Maui programs. Those are programs that help persons with disabilities get them to and from training programs or to and from work, so that they can maintain independent lifestyles. We also do an employment to work program, similar to what was described earlier. Although we work more with the clients, it's more client driven, and we take them to various employers throughout the community. We run rural shuttles that come from areas that are not serviced by public transit, the fixed route. We do youth transportation. We go to the schools, middle and high schools after school, and we let the youth on board. We take them to different programs throughout the county, Boys and Girls Club, Big Brothers, Big Sisters, gymnastics, paddling, whatever they need. And then at the end of the evening, we take them back to their community so that parents don't have to take off of work. We also take people to and from adult daycare. And then we run a system called Alaho, which is a transportation service for persons with disabilities, and it's kind of similar to the paratransit that we run that complements the public transit. And then we do a lot of dialysis transports to and from dialysis appointments. Next slide, please. The rural service areas that we focus on are in Hana, which is East Maui, and back up, sorry. One more forward. There we go. Oh, nope. One more back. There we go. In East Maui, There's a population of about 1,500 people in Lanai. There's about 3,000 residents on that island. And then in Molokai, there's about 7,350 residents. In Molokai and Lanai, there's no other transportation other than MEO. So we are it for everybody. We do a little bit of everything to try to meet the needs of the community. We have a provision in our human services grant that says other community needs, and that allows us to respond to requests from community members to make sure that we're being relevant and that people are getting to where they need to go. Next slide, please. So currently we have over 100 vehicles. We do on the human services side, over 4,000 passengers take rides with us every year, about 183,000 trips. And then on paratransit, which is the handy van service that's connected to the fixed route, we have about 750 passengers and we do almost 84,000 trips. Next slide. Questions?
Is everyone else sitting there going, wow, 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 wow? So Debbie, maybe I'll kick us off. Or first I'll see, does anyone have, oh, you're getting applause in the chat. That's great. Does anyone have questions for Debbie and the team at Maui?
I did want to say something I think I left out. So we used to have 5311 money as well. When the county did their short-term short-range transit plan, they keep all that federal funding now. So they are the direct recipient of federal funding, and they purchase the vehicles that we use for the paratransit, and then we register them and we insure them, but they actually still belong to the county. So if for some reason we ever lost that contract, those vehicles would go back to the county. The human services is a little bit different. It's a grant that goes to MEO because it is the core transportation services that's been here since 1969. That gives us more flexibility because it's a grant. It's paid out quarterly based on, projected trips and things like that. And that is funded pretty much 100% through county general funds. So taxes pay that.
Wow. I was going to ask you about that relationship with the county and, how has that evolved over time, or how do you keep that strong, given, there's always transitions kind of in local government, how do you connect and keep that connection strong?
Well, it's a lot of relationship building. We operate a lot of programs on behalf of our county. So about 67% of our total agency fund typically comes from the county of Maui. So a lot of times people think that we are a government entity, and I say no, we're the nonprofit, designated entity that runs programs. But we basically use our community needs assessment, and we present evidence that says this is what we need. We participate in budget hearings. We have clients go out and testify. Our staff go out and testify. We meet with the mayor every year to tell him what our budget needs are. We meet with the directors of all the programs. So it's a lot of relationship building and a lot of being involved in public meetings and just, keeping our name and our face out there.
That's incredible, an incredible amount of work, and incredible that you've been able to maintain those relationships in that way and be so intentional about it. Bill put a question in the chat as well. Does the county receive 5310 funding, or are you allowed to apply for 5310 funding?
Well, we used to get 5310 and 5311. And again, the county then, when they started running a public transit, they took that. The 5310 funding actually goes to our Office on Aging, the County Office on Aging, and they do some specialized transportation, which is more like one-on-one transports. And that's what they use the 5310 funding for in Maui County.
Yeah, we kind of keep joking about, coordination. But one of the things I hear is, you really have to coordinate with the other partners, because there's lots of different partners who provide different pieces of this transit system, right? That makes it work in your community, really.
Yeah, a couple of years ago, we coordinated a public transit in Maui County Forum, and we produced it for the general public. We had this Office on Aging, Kaunoa Senior Services. We had neighbors helping neighbors. We had Roberts Hawaii, who's doing the fixed route. All of us came together and did a presentation on the different components of transportation in Maui County and how to access those services. And the public television filmed it, and we ran it, on TV. We have links on our website. So I think that's been really helpful. So definitely partnerships are, the most important.
Partnerships are the most important. Heard, seen, felt. On that note, Debbie, I think we're going to move forward then. And Freds, if you have more questions for Maui, we'll have more Q&A in just a little bit. And we're going to pass it over to our friends at West Central Missouri and New Growth Transit.
Hi, yeah, it's Kelly again. So today I'm going to share with you a fairly new transportation network that we have in West Central Missouri, and it's a volunteer transportation network. And so we come from West Central Missouri Community Action Agency. So we're in a region in West Central Missouri, just south of Kansas City. So we have one county within the urban sprawl of Kansas City. And then we have an additional 10 counties that are primarily rural, very isolated. So we've got the hilly terrain of the Ozarks. We have quite a few lake regions. So we're diversified amongst our area, primarily rural. We see the industry in this area is a lot of agriculture. So we have small county schools, county clinics, seasonal employment. And then we also have a lot of tourism employment in this portion of around Lake of the Ozarks. And so we came up with New Growth Transit about 6 years ago, and it actually came out of our Community Development Corporation, New Growth. So it is an affiliate of the Community Action Agency. So that gives us the ability to expand our program outside of our core 9 counties. In addition to New Growth Transit, we're very heavily involved in rural development. So we do a lot with the Women's Business Center. It's funded by the SBA. We also do New Growth Capital, looks at lending with local entrepreneurs. And then we're also really excited that we were able to sustain and save New Growth Food Systems, which is a heartland food initiative that works with local foods. So today I'm going to share with you New Growth Transit, and it's primarily, again, a volunteer transportation network. We began our transportation network with $20,000 that came from CARES funding. So we did our strategic plan. We're funded by HRSA, and it was the same story as what we've heard from the previous 2 agencies. Transportation has been on the top of community needs assessments, I'd say pushing over 20 years. And so while what we had seen typically in our rural areas of Missouri, as we had seen when communities had grants, they might have a bus system that lasted. But the minute that that grant was over, whether it be a year or up to 3 years, then all of a sudden that public transportation option dissolved. And so in Missouri, what we tend to see is we just have OATS buses. And so those buses are 15 plus passenger buses that are involved in 87 rural counties throughout Missouri. And that's the maximum of public transportation that we do see. And so one reason that we felt that a volunteer transportation network would be so successful and sustainable in rural Missouri is because we don't have the large infrastructure of fleets of vehicles. So we have individuals utilizing their personal vehicles. And then we also don't have the expense of bus stops. So it could be something that would remain affordable to sustain in these rural areas where transportation is just few and far between. So next slide, please. So let me explain some of the details of volunteer transportation. First of all, when I worked throughout the state of Missouri talking about launching this program, whenever I said volunteer driver, everybody thought I was talking about unicorns. So yes, volunteer driver programs are very successful throughout the United States. While they were fairly new to Missouri, they're actually not across the United States. And so all of our volunteer drivers utilize their own vehicle. In Missouri, we make sure that they're insured properly at a minimum of $300,000. We inspect those vehicles twice a year start, all of our volunteer drivers are screened up to 20-year background screening. We also look at the state records of their driver record. They are trained in our program after they complete all of their vehicle inspections and all their background screenings. Then we consider them certified. At that point, we train them in the technology, we go on additional rides. And so it's a lengthy training process. We utilize SNAP technology. We use this to schedule, track, log all of the completed miles, and the drivers utilize tablets. SNAP technology was actually created out of Volunteer Transportation, VTC, out of Upper New York State. This is a wonderful technology. It is built for volunteer driver programs. It helps us everything from scheduling to the reimbursement process. And then additionally, we have a partnership with Verizon that allows us to purchase those tablets for $1. So riders call and request a ride 48 hours in advance. There's other volunteer driver networks that can schedule same day or next day. For us, we need a minimum of 48 hours, and all the rides are free. Due to insurance requirements, we never accept the volunteer drivers never accept payment directly from the riders. So a lot of my work and a lot of my staff is working with those partnerships, everything from local partnerships, could be senior tax boards, to regional partners and even state partners to acquire the funding that we need, and foundations, but to acquire the funding that we need to provide those rides. When we were doing our initial strategic plan, we also found out we wanted to understand not only what were the barriers to rural transportation, but we would hear about large buses, 15-passenger buses that were sometimes they had very low occupancy. So we spent a lot of time talking to drivers or riders, to understand what their challenges were. And we found that a lot of riders were forced to use public transportation in these rural areas. For whatever reason, they lost the freedom or the ability to drive. And one of their hesitations to a volunteer driver network or public transit was that they didn't have the consistency of a specific driver. And so with the technology, the SNAP technology, and with what we like to call our customer service, we really try to make sure that the exact same driver that picks them up, confirms the ride the night before, picks them up, takes them to the appointment, is the same driver that picks them up at that appointment and brings them home. We also have riders that request specific drivers. And I think that's why our ridership is so high, is that, like I mentioned earlier in the previous slide, is that so many rural volunteer transportation initiatives have started and then they've just gone away. And so that hesitancy to use something that won't be here for very long was a big challenge. And so having the consistency to provide rides was very important. Yes, we are providing Medicaid trips. I see that question in the chat. So just this year, as of February this year, we did contract services with Medicaid Transportation Management. And so that to us was a huge progress. That was on our 3 to 5 year timeline. We're very excited about that partnership. It expands our capacity to provide rides and help sustain efforts for ride coordinators. So our rides are scheduled, coordinated, and communicated with the drivers by our staff. So individuals call one number. We then enter those rides, create a trip manifesto, and then we email those rides out. The drivers must confirm the night before. So for instance, this is Jay, one of our drivers in the picture. He calls and says, "Hey, this is Jay, and I'm going to show up in a white Ford Edge. And I'm going to pick you up at 9 a.m. And this is very important because a large portion, but not the majority of our transportation is non-emergency medical. And we see those appointments times change frequently, especially the day before. So we're already starting some route deviation so we can improve efficiency and move trips if we need to. And it's also that consistent safety aspect that our riders have grown to appreciate. And drivers receive reimbursement twice a month. And currently we are reimbursing at 70 cents a mile, which was the IRS reimbursement rate. I will share with you that when we originally began, we had some grant funding to reimburse drivers over the IRS rate. And it actually deterred drivers from joining our network because of the difference that they would make, and it wouldn't be a true reimbursement, would threaten some of their benefits. So it was less work on our side if we just reimbursed the standard rate. And so we have found that was a surprise finding in our initial. There was a question in the chat: do we bill Medicaid directly? We have a letter of agreement with MTM. So our billing for our rides goes directly to MTM, not Medicaid. Okay, next slide, please. There should be a slide between this. Oh, okay. Well, I was just going to share before we get on that next slide. I have a lot of questions about volunteer drivers. The average age of a volunteer driver is 55. When we began this 5 years ago, it was closer to 62. So as we expand the network and we expand our capacity to provide rides on nights and weekends, we do see a younger demographic of driver. Many people the reimbursement is appealing. I think that's what opens the door for the conversation. But the true meaning of this work is purposeful. And we find a lot of volunteer drivers, they love those regular customers that they get to know, they get to understand the barriers and the challenges they have to transportation. So we're always inspired by those relationships that are built between the riders and the drivers. And we do find that a lot of where we recruit our drivers is oftentimes individuals that have been in the professions of social work, teaching, nursing, and even law enforcement. So those seem to be the retired groups is where we find a lot of volunteer drivers or individuals who have been caregivers to family members in the past. Next slide.
Is it not going?
No. Okay, so the next slide is lessons learned in rural transportation. And some of the things that we learned when we just launched our network is that there are certain cohorts of individuals that already existed. So for instance, we have a large population of drivers for Amish in our area. And so we went to those Amish communities. We found out who the drivers were. We also recruited them to be volunteer drivers for our program. Like I said earlier, we found groups of retired 3Mers. We have a lot of factory manufacturing around here. And I mentioned seasonal labor. So we have a lot of people that even go south for the winter. And we have teachers that drive for us in the summer. So we've got a lot of seasonal labor here. Well, we've also got a lot of seasonal cohorts of volunteer drivers. And we also recruited active volunteers. So people who are already working within churches or food pantries, even if we could just get one day a week, one afternoon a week, in addition to what they were already volunteering with, those seem to be really good volunteer drivers. And they also helped us find partnerships within the communities. We've leveraged social media. We are only a team of 8 full-time employees. And 2024 was our year that we had our most funding, and our drivers completed over 1 million miles in rides across 11 counties. And so, but we knew we have to constantly be recruiting volunteer drivers. So we leverage social media, and our story throughout our social media is not about our ride service. It's about the people that make it happen. It's about the volunteer drivers, where they come from, why they contribute to their community. And then we put little tidbits in there every once in a while, pictures of our coordinators. So because we believe that the demand for rides will always exist. We will never meet the full demand, especially in these rural areas, but we just feel like we have to start with little bits, little pots of money. We've done, we've assembled small pots of money of $1,000 just to get things going, to build a baseline and start telling the community who needs transportation and where they are going and those distances. And I just want to point out here, we also have an ambassador program. So we have volunteer drivers that maybe for whatever reason aren't able to drive anymore. We even have a husband and wife that cover 2 of our counties. They're very active and they're ambassadors for our program. So they wear polos with our logo on them. They go to the community health fairs. If we can't go to it because we're just a staff of 8, we have ambassadors out there in the program that are recruiting volunteer drivers for us at Biscuit and Gravy breakfast, at some of the town hall meetings. as well as they know people in their community know those ambassadors, so they can also be our advocates for our riders. And I'll open it for questions.
Again, is everybody going, wow, wow, incredible. So I think the questions in the chat so far you've already answered, but does anyone have a question for Kelly? Kelly, while we're waiting for those questions to come in, I might ask you, you know, a lot of times when folks hear about volunteer transit programs, they say, well, we had one, but we had to close it because of the risk, or, you know, it just felt too risky for us to do. How have you, you know, mitigated that risk and made it work in your agency?
Yeah, I think it's a good question. You know, insurance is expensive. You know, we use CIMA, CIMA. They provide volunteer transportation. So it's an additional policy that we purchase in addition to the private individual. We've also had the conversation with lots of insurance companies. So there is a level of risk. But when it comes down to it, we need to provide transportation. And so we do carry a higher non-owned auto policy that's required by MTM. And we have really good private foundations, as well as some of our return that we earn off our contracted services to help us pay for our insurance. So I do believe that we are fully insured to the capacity that we need. It is an expense to the program, but it is not as much of an expense as if we had a fleet of vehicles. So every program has overhead expense, and for us, insurance, one of our larger expenses is insurance.
It's an interesting way to think about it. So thank you. So friends, I think we've come to the point that we would take questions for anyone on the panel. If anyone had questions for any of the great models that you've heard, anything you want to add, anything sticking with you. Maybe while folks are thinking, let's do a rapid round robin of if you had to give folks on the call one piece of advice if they, you know, are trying to start or grow their transit system or transit program, what would you say? What would your advice be to your colleagues? Eileen, Debbie, or Callie, anything you want to put in?
I think mine would be to embrace technology. Like I said, we've got a great partnership with Volunteer Transportation Center, and we knew in the beginning that we originally were just a team of two, and so we've been able to utilize technology. We'll continue to make that investment. We found that private foundations, it's appealing to them to invest in that technology. So being able to leverage that, I mean, we need to have a person on the phone who is handling, you know, I don't ever anticipate that will be an app that people will schedule a ride with. I could be wrong. But you know, looking at the office everyday administrative and using technology to bring efficiencies to those systems have really helped us expand the amount of counties that we can serve.
Awesome.
And for us, we're using technology as well. We have an electronic scheduling system. We have voice over IP phones. But in the rural areas, that creates some challenges because of connectivity. So there's certain pockets where the system is not reliable, and that creates some unique challenges for those operators and for the clients as well. But it definitely does help with capacity, and there's ways to allow people to do their own online reservations, even cancel trips, which is really helped in terms of the amount of staff that you would need to manage your operation.
Great. Eileen, anything you want to add?
I actually agree with both of them, and especially Debbie up here in the Panhandle. There's so many miles. Connectivity is extremely difficult for us, but if you really believe that you have a program that will work and be successful, you just got to be very persistent, and nobody can be more persistent than I can. And then you have to have buy-in from your staff, because every time I go into my operations manager's office and say, what about this idea? He just does this, puts his hands over his ears because he knows it's going to be a lot of work. But because Transit to Work is just one small, program that we run here at the Panhandle Transit. So,
Staff buy-in is critical. Be nice to your staff, period. Right. Awesome. So there's two questions in the chat. One is, what attracts volunteers to be drivers? What brings them in?
I think that's a great question. Like I said, we tend to find individuals that have that volunteer spirit. I do think that they like the flexibility. So every week we send out an email asking them what is their availability for the next week. And so individuals, like I said, they might be over Christmas and New Year's. We have a lot of individuals out of town, they're with their grandkids. So they like the flexibility of nights or weekends. And then again, we tend to find a lot of individuals that had been in law enforcement, teaching. That was what they've done in their professional career. And so they find that being a volunteer driver can fill that purpose for them that they found so wonderful in their professional career.
Great. One more question, and then we're going to pivot to Bill. So there's a question about, can you share about safety training you put drivers through, both fleet and volunteer? And is there, a curriculum that you might recommend? And that's for anyone on the panel.
I have an amazing trainer here, and he does an extensive program with our drivers. We have to have past training. And then he rides with the drivers. I mean, we don't put them on the road by themselves probably 2-3 weeks after employment, but I would like to ask Kelly a question. So you don't follow under any FTA DOT at all? You don't have to follow their guidelines at all?
We do, the guidelines we follow is like we do extensive HIPAA training we do some, like we do ride with them also, make sure that they're, following basic traffic laws. And like I said, we look at their background screening. We also do mental health first aid, and we do CPR training. We do 2 annual trainings, or we do 2 trainings a year. And then we also inspect their vehicles.
But I was talking more like drug and alcohol.
So we currently, unless we feel like there is a need, there's been some sort of complaint, or we're noticing, or they've reached out to us. Now we extensively go over, but no, we don't do drug and alcohol training. We are not required to do that.
Okay.
Any other thoughts on the safety training from Debbie or Kelly?
I think training is definitely the key. And for us, I know we have a separate volunteer transportation line for those drivers. So they can call us in the event that they're, they question a trip, or they have any. So the training is key from the beginning. It's heavy, and we know if they can withstand the training, then they really are committed to the demands of transportation. And then annual training, I think, is important. Always refreshing individuals about different things, and then being able to be available for their questions. I also think that's important with drivers.
Yeah, and for us, in addition to the technical training, we do customer-driven service training. So we do spend a lot of time about how to work with persons with special needs, making sure the customer service is tailored to the needs of the individual client. We transport a lot of very frail people on our system throughout the county, so that's extremely important.
I would just point out, going back to the original question about this, that, and this isn't to take away from Kelly's training that she invests in drivers, but because these drivers are not paid, they're reimbursed for expenses. B, they're driving their own vehicles. And there was another point, I can't remember what I was going to say, but that's why they do not fall under those DOT guidelines that you are looking at, that you are held accountable to. Not to say that Kelly or any other volunteer driver program is just throwing people in a car and telling them to go on, CMS or Medicaid, the state Medicaid offices may demand certain levels of training for that, depending on, this is state by state basis. But when it comes to the DOT training, they're not being paid drivers, and they're not. That's the other point. They're not charging people for rides either. So that's how they can, get by that.
Good context, Bill. And this feels like a really good time, Bill, actually to pivot your way to talk to us a little bit about CCAM-TAC and some of the resources that you have available through it.
Well, isn't that good timing on my part, huh? So, yes, we are a federally funded technical assistance center. Before I get going, it's important to understand what CCAM actually is. And CCAM is an interagency council that's made up of 10 federal departments: USDA, HRSA, FTA, CMS, there's some I can't. Department of Labor goes on. You can go to the next slide. I think I have it in one of the slides here. And we were contracted. Here are some of our federal partners that make up the CCAM, the Council Coordinated Council for Access and Mobility. This group started 20 years ago under President Bush, and one of their early strategic plans was to create a technical assistance center. We are the kind of the link between the boots on the ground services, the transportation providers, and these federal departments and the policymakers. So that's kind of the role that we fill. I don't give anyone a ride. I don't even pick up people in my car to drive. I'd love to be a volunteer driver, but nobody gets along with me. So our role is to provide assistance to you. And I go on, you can go to the next slide. I'm going to talk a little bit about what kind of resources we offer. When we were putting our proposal together, I decided, in addition to these federal advisory committee that I had of those federal departments, I wanted some content expertise. Our mission, our goal is to improve human services transportation for any individual that may have a barrier utilizing public transit, non-emergency medical transportation, and even private providers we are working with in that capacity. So you can go to the next slide. And you can see, you'll hear me through my presentation throughout a lot of these, Bill's words of wisdoms. The first one is nobody rides the bus for the sake of riding the bus. We want to talk about the impact in your community, the impact on people's lives. Whether we're talking about looking for funding or we're talking about improving services, but all of this centers around your human services coordinated transportation plan in your counties, in your regions, in your states. How do you do that better? How do you identify the needs? And the process that we work through, and we do on-site technical assistance, will go right to your community and help you, dig into your community and find the needs. And we will, offer suggestions for services, help you come up with determinations for what will meet your community needs, and then we'll look at different ways to fund it. So, next slide. So as I mentioned earlier, part of my role is to support the CCAM, the interagency council that was formed. There's a CCAM program inventory. We have a guidebook that lists 140 different federal programs that provide some sort of funding for transportation. That makes up the CCAM program inventory. And you notice earlier when you guys were presenting, I asked some questions about, do you get 5310 funding? Do you get 5311? Are the employers contributing, and all of that shit? All of that is to show that, a lot of transit systems function only on FTA funding and their local match. And there's so many opportunities. And one of the reason this community action partnership is a good partner with us is that many of you have multiple federal programs in your organization, and you can use these programs to leverage more money, more funding. It's not like you're taking, dollars out of another program's budget. It's a way to leverage more funding through whether it be FTA or another federal program. The process I'm talking about referring to is the CCAM Federal Braiding Guide. And this is something that we have the CCAM agency has created the inventory, done a lot of work on putting together guidelines, and we have taken that work and put it into a guidebook that it's available to anyone who wants to see the guidebook, wants a copy of it. But it's also, we will travel to your community, to your conferences. I believe in January, I will be in Orlando with a group from the Community Action Partnership, and we'll do a workshop. We'll go step by step through this guidebook to show you and teach you how you can leverage funds within your agency to improve your transportation services. And again, it's not about taking money away from anybody. It's just using other federal funds to leverage additional funds. We work closely with CMS and Medicaid. If you go to our website, you'll see a state-by-state profile of all of the Medicaid transportation systems for each state, how they work, contact information, and all of that. And then most recently, we have developed a trip cost allocation tool that you can implement into free of charge into your daily workflow and help determine how you can charge and bill out for rides from multiple funding sources. Let's say you're providing transportation for a Medicaid person, and Medicaid does not want you to transport anyone that's a non-Medicaid person, even though if they're going to the same place. This tool will allow you to allocate the cost of your trip and provide you the documentation that you could take someone to the VA clinic, a Medicaid patient, a Medicare patient, and maybe a private payer, all on the same vehicle, breaking down those costs per payer unit and per individual. And it could be not necessarily a trip where they're all getting on the vehicle at point A and only going to point B. You'd allocate for the distance. I apologize, I thought I turned that off. The distance they were riding for their particular need. Next slide. So that's how we support CCAM, but how do we support you? It starts, first thing I tell people is check out our website. We keep you up to date on industry news. We have a monthly newsletter you can sign up that informs you of potential funding sources. We highlight some current events that are happening. We highlight webinars such as this or meetings that we'll be attending, and that we have the trip cost allocation tool where you sign up on our website, and then once again, it's free of charge. You go in there and you just incorporate. We provide the training necessary to use it, and you start working it into your workflow with the rest of your scheduling software in that. We have a section on trainings. We provide some e-learning courses. We're currently developing an e-learning course. I'm excited about this. I was just earlier today looking at some of the modules that just were finished on writing a human services coordination plan. What's the best practices for doing that? If any of you are getting, federal FTA funding, it's required that you have for 5310 funding, it's required that you have a coordinated human services transportation plan. And this goes through, step by step, easy to follow, and some really great graphics. We have webinars, we have trainings available, and other tools, industry-wide trainings that maybe we're not doing, but we'll keep you abreast of what's going on in there. And the last resource I'm going to talk about on our website is we have a community transportation provider map. A couple years ago, FTA asked us to find out any provider that is providing transportation services and receiving FTA funding and put it into a searchable database. So on our community provider map, anyone that receives FTA funding, whether it's 5311, 5310, tribal, mobility management funds, or even volunteer driver programs that are receiving FTA funds, can upload their data into our database. It takes about 2 minutes, if that. And you will then be listed on this searchable database that individuals, one of the best uses of it that I've heard recently is for Cineas as part of their standing operating procedures in their dialysis clinics. All social workers, anytime anyone addresses or misses an appointment because of transportation, they walk through this map with them and they can put in their address and they can see what transportation options are available to them. And, if there isn't a public transit provider that can provide their needs, we can connect them to the closest mobility manager, which would have the knowledge of the local resources outside of FTA funded programs. Next slide. Um, I lied a little bit. There's another part of our website called Communities of Practice, and you can see these 8 categories, targets of populations that are identified, and we talk about different ways they're being served for transportation, including blending funding or braided funding with FTA and other federal agencies, other federal dollars, and it gives you ideas. Another words of wisdom by Bill. There is no reason to recreate the wheel in this world, in this business. Take an idea and adjust it and adapt it to what your needs are in your communities. And you can have success that way. So you can see, individuals with disabilities, older adults, housing, all of that is part of what we are doing with our CCAM-TAC Center. Go ahead. Next slide. Here's the community provider map that I was talking to you about. And we have now linked it up with policy map. So in addition to finding transportation providers, we now have made this so all of these purple boxed in areas are service areas of a provider that we have identified in our map. And you can now layer using policy map. Say you're looking to provide services for older adults, you can layer the demographics and find in your region where the highest percentage of older adults are living or the highest number. You can look at income levels. If you're looking to serve individuals living in poverty, you can layer that into your own individual transportation area. Or you can identify where there's deserts, transit deserts or food deserts or whatnot to determine the need. So as you go and work on your coordinated plan or you're going to write a grant up for funding purposes, this is a great tool to identify need and help you establish that. Again, this is available through our website. The only requirement is you send on our website, there's a link that you have to complete a survey. It's like 5 or 6 questions, and that, asking for access, and then we grant you the access free of charge. So, in the database or in the provider map, we were looking for ways to show the locations of the federally funded transportation providers. We wanted it searchable by home address, by region, by city, multiple ways of doing a search in that database. We also wanted to show not just, in our first version, we dropped pins on where they were located, but many people know that where your home office is, your bus routes are covering a lot bigger areas. So it was important to us that we showed your service area so people could look at a map and generally see who was providing transportation information or transportation service, and then find the information to contact that provider to get more particular information about scheduling, fares, and whatnot like that. So again, to kind of show you how easy it is to put your information in, go to our website. There's a link. You fill out this survey. I was doing a presentation on this in Washington, I think Spokane one time, and there's 50 people in the room, and I had the survey on the slides and I was showing them, and I showed them the link. And by the time I finished the 5 or 6 questions that it was, everybody had their phone up with a QR code and was typing it in. And within, back at the office in DC, within 2 minutes, we had, 40 some people submit their information, all while I was basically reading the questions to them. It's that simple. It doesn't take any longer than reading 5 questions, unless you type on your phone as slow as I do. You can do it in no time flat. Next question or next slide. So I mentioned earlier, we provide a lot of on-site technical assistance where we will come into your community, usually facilitate a half day or a full day workshop. We bring food, we provide breakfast and lunch. We do this at state level. We've worked with state agencies. We do it at a regional level. We do it down into county or community level. I mentioned the Human Services Coordinated Transportation Plan. We will facilitate the initial dialogue for you and help you get the right people to the table for your meeting, and then facilitate the discussion to come up with ideas on how you want to go about providing the services and look at sustainability. In this, business, it's not doing anyone any good to create a system that works for a year and then disappears. So we're always concerned before we go and start a project that we have a sustainability plan. And then we've worked with groups in creating a state mobility management program, or a state mobility management council, where it's about coordination, region to region, and working together that way. All of those free of charge, all of those available to apply right on our website. And typically the process is you fill out the small survey, tell us what you're looking for. We have a few phone calls going back, or Zoom meeting going back and forth. Then we pick a date and you invite the stakeholders. We invite community members into the meeting, and we facilitate this discussion and hand you a nice little report when we get back to the office and have time to write it up. Next slide.
Hey, Bill, I think that we are needing to move to breakout rooms. Do you
Okay.
have one other point you want to
Yep, I'll just
make?
got exactly one other point. Go back to the one slide. This is very important to me. And I heard a lot of talking today about people that were telling how many trips and how many miles, and all of that's great. But I think it's important to remember anytime you're looking to get an investment in your program, whether it's public or private, you somehow have something to talk about on what is the impact, whether it be through healthcare, whether it be through employment, accessing food, or whatever. Measuring the impact on your community is critical if you're looking for investment, especially as times are tough. Competition for grant funds is getting greater and greater. So we offer this training. It's called You Get What You Measure. And it's, again, a full day workshop will come into your community, into your community action agency, establish some goals, and then look at figuring out measurements things that you can track that we're going to speak the language to your funding sources. So that's the last thing I have to say. Any questions? I have my contact information. Feel free to shoot me an email.
Thank you, Bill. And Bill is one of the most responsive people I've ever seen on email. It's incredible. He will get back to you right away if you email him. So we do want to move to some very now brief breakout rooms to give you some time to connect with one another. It's one of the things we promised that we would do together. We have rooms that are set up by topic, and you are welcome to join whichever room suits your fancy. And so Karis is going to open the breakout rooms, and you're not going to move automatically. You're going to have to scroll down and select which room you want to join, and just click join right beside the topic that you want to go to. If you want to talk to our friends in Panhandle about transit to work, go ahead and join that room. If you want to talk about removing barriers to rural transportation with our friends in Maui, join that room. And if you want to talk about volunteer driver programs, please join that room. So Karis is here if you need any help getting where you're going. And we'll come back together here in the main room at 3:28 Eastern Time. So we'll see everyone soon. So I was saying, friends, this is going to be a very fast wrap up. This has been a fabulous forum. And I want to say thank you so much for all of your participation. I hope that you've learned a whole bunch, made some new friends, learned some new things. As we're wrapping up, I would love if you would put in the chat any ahas you had or something you're really excited to take back to your agency or just something you're excited about. So if you just want to put in the chat your aha or your, what you heard that you're really excited about, we would love to see that. With 1 minute remaining, I also just want to say, this is a piece of more work to come. We're going to continue our partnership with CCAM-TAC and Bill as long as he'll have us into the next year. And so we hope that you'll stay in touch. You can sign up for that CCAM-TAC newsletter at the site that we put in the chat a little bit earlier at the CCAM-TAC website. And then also at NCAP, we're trying to get a deeper understanding of the transit projects that agencies run. So if you've got something great you want to share with us, you can email us at transportation@communityactionpartnership.com. Really, really creative on our part. And then if you're coming to the conference at the Management and Leadership Training Conference in Orlando, we're going to have 2 transit focused sessions there. Our friends with the Collaborative on Economic Mobility are going to host a session featuring some community action transit models. And then Bill will also be with us, and he will be doing a federal fund braiding session where you can practice that federal fund braiding practice that he shared from the federal fund guide. So you'll get to come put some hands-on practice in if you join us at the Management Leadership Training Conference. Last note I want to make is to please, please, please take the session evaluation. I will post that again here in the site or in the chat for you. Please take the evaluation. Let us know what you thought of this. Panelists, colleagues, anything you want to add before we let folks go? I see heads shaking no. With that, then, let's say thank you to all of our incredible panelists who are so generous in their time and knowledge. And thank you to all of you for joining us this afternoon. And we look forward to seeing you in the new year. Have a peaceful and beautiful holiday and winter season. See you soon.
Thank you, everybody. Bye-bye.